We'll wait for another 2 to 3 minutes and then we can start now.
Okay, fine.
Gopi sir, ready?
Yes, sir, ready.
Okay, sir. We'll wait for another couple of minutes. Let other participants join. Then we can start the session, sir.
மேம் ஒன்றும் இல்லை மேம். இப்போ நம்ம அந்த ஐஐடியோடது வந்து ஏப்ரல் வந்து 5th கொடுக்கணுன்ற மாதிரி மெசேஜ் அனுப்பிச்சிருக்காங்க. நம்ம வந்து இந்த இதில் வந்து இந்த 4 இப்போ 2 எடுத்துலாம் இல்லை மேம். 4 செஷன் பற்றி வெளியே முடிச்சிடலாம்.
எடுத்துருங்க.
சரி மேம். அப்போ பசங்க எப்படி மேம் ஜாயின் பண்ண சொல்லி நம்ம சொல்றது எப்படி மேம் பண்ணலாங்க
மேம்? நான் ஒரு மீட்டிங்ல இருக்கேன்.
இல்லை அதுதான் கேட்ட காலேஜில் இருக்கீங்களே. சரி மேம். சரி நீங்கள் அப்புறம் நம்ம சாயந்தரமா பேசலாம். சரியா? ஓகே ஓகே மேம். பை.
A warm welcome to all gathered here. Once again, on behalf of Department of Electronics and Communication Engineering, Panimular Institute of Technology, we welcome you all for the Day 2, Session 2 on AICT-sponsored Sttp on medical healthcare for betterment of humanity via non-invasive technique. Herewith, we have Dr. S Ramapraba, HOD, EEE Department, Panimular Institute of Technology, to share our insights on medical imaging, disease identification, and feature extraction. Welcome, ma'am.
Thank you, sir. Thank you for it.
It's indeed my great privilege to introduce the chief guest to this August gathering. Dr. P.S. Ramapraba, Professor and Head, Department of Electrical and Electronics Engineering, has got 20 years of teaching experience and 12 years of research experience. Our research interest is image processing, medical imaging, embedded, and renewable energy. She has graduated from S Ramapraba Engineering College, Madras University, Chennai in Electrical and Electronics Engineering. She has obtained her Masters in Satyabama University, Chennai, and PhD degree also from Satyabama University. She has started her education career in the year of 2000 as a lecturer. She has accomplished groundbreaking research on early diagnosis of cervical cancer using colposic images. This astute research has brought her the pride of owning doctorate in engineering and biotechnology. She has jubilantly participated in numerous national and international conferences conducted by reputed organizations. She has published several papers in international and national conferences and journals. She has also patented her work in IPA, and she is a member of IEEE, life member of ISTE, IETE, and IEI. She has received Outstanding Woman and Young Woman Scientist Award. With her huge profile, it's indeed my privilege to welcome you, ma'am. I hand over the session to our speaker, Dr. P.S. Ramapraba, ma'am. Welcome, ma'am.
Thank you very much, Arun sir, for your brief introduction. Thank you. Once again, I'll welcome all the participants of this Sttp medical healthcare for betterment of humanity via non-invasive techniques. And now today what I'm going to take is a medical imaging in that medical imaging, disease identification, and feature extraction. First of all, I'd like to convey some messages. From cancer to diabetics to the recent rise of COVID 19, we will all likely to come face to face with threat to our health. Contemporary medicines has ever improving tools to identify and combat diseases, but there are gaps in speed, in variance, in coherence, in access, in accuracy. We can do it better also. See how we can ensure that new approaches to provide the same level of the diagnostic potential as are currently in service. Actually, the title itself it is in terms of the invasive, non-invasive technique. So we have to go within that non-invasive method. We have to go with the accuracy. When we go with a non-invasive method, people will think that we won't get accuracy and the speed and coverage and all. But now in non-invasive also we'll be getting accuracy and coverage, access, and everything we'll be getting it. See, we know medical image, which is consists of the visual representation of the interior parts of the body, such as the organs or tissue, for a clinical purpose to monitor the health, diagnose, and treat the diseases and injuries. So now we are going for the diagnosis of the diseases. Before going for the diagnosis of the diseases, as I already told, as I already said that non-invasive method, we are going to deal from the cancer to the COVID-19, which is actually first we'll see about the breath biopsy. Now, this is the breath biopsy is used for detecting of the cancer with the non-invasive method. This is a tool called the breath biopsy, a non-invasive tool for the early detection of the disease and cancers, mainly which is used for lung cancer. Okay, see the cancer when we just if we pronounce a cancer itself, everybody's mind will be go with the blood only. They will take the blood and they will take test tissues, a biopsy like that only. It will go into their mind. Okay, see we'll go with this non-invasive method. When we go with the non-invasive method, sure we will get some idea about the disease, and we can further for the treatment we'll go with a disease treatment, a particular treatment. So when you think a diagnostic, that's what when you think of diagnostic for disease and cancer, the first that probably comes in all of our mind will be using the sample, blood, tissue, biopsy, and everything. But this particular equipment, breathe biopsy. See, in our breathe, what we inhale and exhale, no? What we exhale from that breath, we'll be getting more diseases will be identified. And this is the this method is having the merit, their merits, interest growth in a less intimate breath. So what we are going to analyze with the breath means by analyzing the pattern of gaseous molecules called volatile organic compound VOCs exhaled in breath changes in what we will they'll be keeping that component in that machine. What we exhale will be that changes the metabolic activity associated with the diseases and can be detected. That disease can be detected. The non-invasive tool, what which consists of, will be mainly which will in terms of the mainly will be using for the lung cancer. Okay, so environmental and the drugs and microbes that will be there, and when we breathe that, that will give the values. At the end, I'll show you the equipment also. A breath testing offers a straightforward, a non-invasive way to monitor our biology, providing a potential tool for the early detection of diseases and optimization of the treatment through the precision medicine. The potential of exhale breath analysis is huge, with application in many fields, including the diagnosing and monitoring of the diseases, However, as with any phase of research that related to relatively new and numerous of crucial changes will be needed, and that routine clinical implementation is possible. And this is when we go for this paper, which is published in 2018 itself, and 2018 July 19, the DOI is at 10.33. You just check with this paper, we'll be getting a breath biopsy enable the non-invasive collection and analyzes the volatile organic components in the exhaled breath, providing valuable information about the disease process occurred in the uh, body. And metabolic changes occurred in cancer cells at the earliest stage of, see, which is actually very well. A cancer when we diagnose earlier, cancer when we diagnosed earlier, which will be curable. Any cancer which is early detection is curable only. So that cancer cells whatever we are detecting in an early stage, we can cure early, no. So this is a non-invasive method, better method for the lung cancer. Because the cancer and all, we can't see it in a stage 1 and stage 2. We mostly the people will diagnose in uh, the stage 4 only. So this method, when we use this method, which is easy to diagnose the lung cancer, and this metabolic changes occur in a cancer cell at the earliest stage of the diseases. So when we check with this breathing of the particular patients will be diagnosed easily. uh, and that we'll see this. Okay, breath based biomarkers for early detection of the cancer and potential application for breath biopsy in enabling precision medicine in cancer. See, how do we diagnose disease using the breath? That's already I told you before seeds. Breath samples contain specific molecules, and that can paint a picture of a patient's health. Even this is a equipment which will be used to detect the breath. Okay, the tubes, sorbent tubes will be placed over here. See, like this tubes, uh, which will be placed. This will be placed near their nose, the person's face, and that breath will be uh, captured. And with this, clean air supply will be there, and CO2 and pressure sensors will be applied, and bacteria filters also will be presented, and which will be the controlling mechanism will be placed with the Arduino board, others, or whatever the processor they are connected, no, that will be connected, and that will pump and which will be raised. And in this tube only the particular air will be collected, and this particular molecules, the bacteria will be. Even nowadays, what we are doing, we are because of this COVID-19. That's what I at initial stage I told you that cancer to diabetes to the recent COVID. So we'll be why we are wearing the mask. Our breath will contain our whatever we are our breath or what we are yeah, exhaling, no, that will be having some bacteria. That bacteria will affect the person. That's what they are giving the 1 meter distance, social distancing, everything they are taking it. That bacteria will affect the another person. So in order to protect that only, we are keeping the mask, we are wearing the mask. So that bacteria VOCs will be collected in this sorbent tubes, and that will be taken and for the further processing of the identification of the disease. With this, immediately this is the invasive method, but lung cancer and all we can't diagnose in the early stage. Sure, the cancer they will be diagnosing with the stage 2 or stage 3 only. When we use this equipment, we can diagnose with the stage 1 itself. When we detect in a stage 1, we can easily cure the lung cancer. So this equipment will be non-invasively. That too, to find out that usually they'll be taking the blood and then samples of the lungs for that more tests will be conducted. They will do some biopsies and all. So instead of that, directly with the breath, we can analyze this. This is a one method of non diagnosing the diseases, and with this bacteria affected in this tube will be collected, and which will be given for the further process. Yeah. When we watch this, I'll show you the a video. If you want, you can look at afterwards how they are placing this in future. How they are placing this. I'll show you the video clipping for this. Aren't able to show you the with the volume. Just I'll show you how their tubes are collected and they will be placed for the further. Which is mainly used for the lung cancer only. See, that's what I've given you the CC. Okay, symptoms. Some symptoms, if they are having any breathing problem itself, we can take it into the treatment room. Will be best on 5% and often less. But we can take the people and we can place it. See, they will be taking this particular equipment. This is used to diagnose the lung cancer. See, these rods, no, this will be collecting, this will be diagnosed. This is used to analyzing this equipment with that, which will be connected with a system which can be analyzed that disease a rate. By using the breath sample itself, they will be analyzing. This is the equipment what I've shown in the image that will be taken. Early detection of the lung cancer. Sometimes, usually, which will be collected in a bag, so that will leak. So with this, it is not possible. See, the processor, what we are using, no, they will be glazing, and the pumps and rods will be connected. So you can see how they are preparing that equipment. That rods only, they are keeping it into the analyze. The for the further analyze, they will be taking the rods and they will be placing it. With that, they will be detecting the cancer early detection. Is not, which is a very easy method for detecting the lung cancer. That rod actually 2.0 is the rod of the result will be coming within 24 to 48 hours. So within 24 hours, we'll be getting the results. It's a very easy. It is at present. This is what is there in a non-invasive method. Yeah, thank you. And this is another YouTube. The person who has introduced this with biopsy machine. He has given that this machine which will be actually worth for that. mainly which is used for the lung cancer and diagnosis of, which is in Europe. Okay. Okay, now we'll move on to the next topic. Okay. Next is an artificial intelligence in medical care. Here also they've used the artificial intelligence, and lot of healthcare industries in India also needs automotive various tasks, and they are using